The UP College of Medicine continuously strives to be at the forefront of medical innovations and best practices in the country. In line with this vision, the Philippine General Hospital, UP Manila's training, service, and research hospital continuously strive to improve its facilities and upgrade its services. Through the leadership of Dr. Agnes Mejia, the Dean of the UP College of Medicine, patient safety and medical education through simulation have been advocated. The UP-PGH Department of Otorhinolaryngology, under the tutelage of Dr. Puntejos, the department chair, and Dr. Tuazon, the chief of division of Laryngobronchoesophagology, has recently acquired a CO2, KTP, ARC laser machine and diode laser for the management of ENT, head and neck cases. In UPCM and PGH, patient safety is a top priority. Simulation and experiential learning and proper handling of instruments have been proven effective in promoting patient safety prior to patient exposure. This video will serve as an instructional manual for the residents, nurses, and students on the safe use of laser. Laser is a term which originated as an acronym for light amplification by the stimulated emission of radiation. The different properties of laser allow it to be focused to a tight spot, enabling its use in different fields such as medicine. Medical applications of laser include cosmetic skin treatments, cellulite reduction, hair removal, kidney stone treatment, and laser surgery. Different wavelengths allows for different applications and different types of laser, CO2, KTP, and YAG, among many others. The new technology combines a wide range of lasers, ranging from green 532 nanometer to the invisible CO2 10.6 micrometer. The ARC laser platform treatment system allows stacking multiple laser systems on top of one another, thereby allowing a wide range of soft tissue clinical applications, which offers performance, precision, and portability. The laser's many potential applications do not come without danger. Improper use of laser may result in patient or hospital staff injury. Through laser's mechanism of fluorescence and thermal emission, its use should come with adequate safety protocol in anticipation of potential adverse events, both to the workplace and to the medical personnel. Everyone inside the operating theater should be well aware of the risks, hazards, and control measure involving laser use. Regulation warning signs posted visibly at eye level on each entryway into the operating theater and removed when use of the laser is completed. The machine should be properly set up. Emergency stop buttons should be identified in case of untoward events. A fire extinguisher and a container with water should be readily available in case of fire. Prior to the actual procedure, an operational training with demo return demo using a simulation model may prove to be useful. To easily remember the safety measures in handling the laser, we developed a safety checklist summarized in 8 steps. Just remember the acronym LASERPOP. L. Examine the laser. An appropriate laser warning sign should be visible outside the entrance to the operating room when the laser is in use. Doors are kept closed, but never locked at all times during the laser use. Laser light's aiming beam and alignment should be checked prior to the use in the patient. Laser fibers should be examined for breaks or damage along the sheath and on the distal tip. A. Manage airway and provide protection for airway fire. Avoid use of dry and flammable materials within the operating field to avoid risk of ignition. Laser-compatible tubes should be used for laser procedures to avoid combustion. Advise the anesthesiologist to lower the FiO2 to less than 30% when about to start using the laser. A fire extinguisher and a container with water should be readily available in case of fire. S. Cover all surfaces and provide evacuation for smoke. Skin surfaces should be covered to avoid contact with laser. Use moistened towels or sponges to drape the patient. Smoke evacuators for laser plume, which may contain airborne contaminants, should be available. E. Protect the eyes. All personnel must use an appropriate laser protective eyewear depending on the laser wavelength. Clear goggles are available if CO2 laser is to be used. On the other hand, orange goggles are available if KTP laser is to be used. Patient should be provided with protective eyewear or other types of eye coverings like wet gauze pads. R. Know when you're ready to lace. Press ready when using the laser and put it on standby mode when not in use during the duration of the procedure or as instructed by the surgeon. Surgeon directing the laser energy should be in control of the foot pedal. P. Patient should be well informed. Patient should be aware of the laser procedure, its indications and possible complications. The patient should also sign an informed consent form. O. Operators. The operators include the surgeon, anesthesiologist, and assists. They should be properly trained and oriented on laser safety. P. Personnel. Personnel include the nurses, observers, such as students, and the laser safety officer. All should be aware of laser safety and proper operating room decorum. This simulation video should be able to educate and remind the operators and personnel on the safe use of laser in airway management. What do we do in case complications arise during surgery? The two most important events for which ensuring safety is utmost priority include the possibility of airway fire and the potential bad effects to the personnel's eyes. In case of airway fire, disconnect oxygen supply. Flood area with water or saline. Immediately extubate the patient. Establish oral airway and ventilate with anesthesia mask. Bronchoscopy should be performed to remove foreign bodies and lavage the trachea. Evaluate injury to laryngotracheobronchial tree. If necessary, perform a tracheostomy. In case of body or drape fire, disconnect oxygen supply. Flood area with water or saline. If the fire spreads beyond the patient, unplug all electrical devices. Notify the fire department. The most obvious and easiest method of addressing laser complications is to prevent them from starting. In summary, let us remember: L. Examine the laser. A. Manage airway and provide protection for airway fire. S. Cover all surfaces and provide evacuation for smoke. E. Protect the eyes. R. Know when you are ready to lace. P. Patient should be well informed. O. Operators. And P. Personnel should be oriented and follow proper laser safety protocol.